for one thing, it's a really well laid out conference from the standpoint of information that's provided from a mental health standpoint, in looking at things from just basic psychiatry, from a wide variety of disorders, from depression to schizophrenia to mood disorders to eating disorders. But more importantly, it's how to really understand these disorders from an integrative medicine standpoint, looking at things that are going on medically with many of these patients, from a nutritional issue or nutritional imbalances, from food sensitivities to chronic infections, metal toxicities, things that typically really aren't discussed in the world of mental health. So it's moving beyond just the use of psychotherapy and medications. It's understanding how those things are implemented along with a much more comprehensive, what's called integrative medical approach, and understanding how supplements can affect these patients, how dietary things can affect these patients, why it's important to do specific testing, why it's important to understand how to integrate this type of information from a more comprehensive standpoint. Because the reality is, and I know as a physician that's been working in the autism field for many years, but also having worked with adult patients with depression, schizophrenia, that the medications they're on commonly aren't working. Patients aren't getting well. They're feeling more and more frustrated. So as a physician, I really appreciate being given the information about how to go help people in a more comprehensive way, and just really bring about healing at a level that just hasn't been accomplished at this point. And I think that's one of the greatest benefits to this conference, and I think for future conferences for other physicians and healthcare practitioners, is just understanding what else is out there, because the information here is so scientific and so comprehensive. You're not going to be disappointed at all.